Good afternoon. Welcome to Thursday live reading live session. This is me Vandana PS joining you from 𝐻𝐂𝐻 Academy. How is your day? How is this beautiful Thursday? Okay. So today let's begin with time management. All right. Yes. Good afternoon. How are you? How are you all? Yes, so I was saying this about time management. So today we are starting the session with time management. And the completion of part A or finishing part A within the stipulated period of time is the major difficulty for most of the students. Okay, so how many of you have the same problem? The time management for the completion of part A? Please let me know the problem with time. All right. So as we know, this exam will be for 1 hour. So in this 1 hour, we are spending almost 15 minutes for the completion of part A. So to complete part A within this 15 minutes is the most difficult task for majority of the students. Right? Okay. So yes. Good afternoon, Yogeshwari. Yes. Sarala, Jilmi. Yes. Good afternoon. Lima. Good afternoon. Yes. Okay. So do you have this problem of time management for the completion of part A? Okay. So today we are going to deal with how can we complete part A within 8 minutes of time. Within 8 minutes. So when I say this, it will be very easy for you to hear all this, to listen this very easy, and I can complete the session. I mean this talking about this part A within 8 minutes, it will be easy for me. I can complete this within minutes, a couple of minutes I can complete the session. But the problem is that when you guys are applying this technique, when you guys are practicing this technique, it will be difficult. So without any good understanding or without any lot of effort, it will not be able to apply this particular thing to your reading skill. Clear? So let's start with another topic. Another topic is here, that is osseous surgery. Okay, so in this topic, we are just jumping into the how can you finish this part A within 8 minutes of time. Okay. Good afternoon, Bibi. How are you? Clarina, Raki. Yes, good afternoon. Okay. So let's look into the material. Okay. So as you all know, we have 4 texts in part A. Text A, text B, text C and text D. So within this 15 minutes, we have to read all these 4 texts and we have to finish 20 questions. Okay. So what about the time management? That is our prior topic today. What about the time management? Okay. So when you read these 4 texts, it is very important to know about some kind of technique or a strategy. Okay, so through constant effort and practice, we can make it possible. Okay, for example, I'll tell you first of all about what is the strategy that we are using to complete this part A within 8 minutes. So we are using the technique or the strategy called skimming and scanning method. So what is skimming and scanning method? In simple words, you can say skimming and scanning, which means speed reading or fast reading, and we are identifying some kind of special or key words from each and every text. It's important to fast read, plus we are marking some key words from each of the texts. Okay, so it will definitely help you to complete the session, or it will help you to comprehend what you are doing. Okay, And the next important second step is that after reading and after marking all these keywords, Then we are moving to a set of questions. So in part A here we have 3 set of questions. So the first set, that is 1 to 7 set of questions, which are called match the following questions. And what about the second set of questions? That is called short answer questions, which is 8 to 14 short answer questions. And the rest of the questions that can be called fill in the blanks questions, that means 15 to 20. Clear? Okay, so within this time we have to complete 4 texts, we have to read fast, as well as we have to mark certain keywords from the text, then we will finish all these 20 questions. Okay, so once again I am saying this, only through regular practice we can make it possible. Okay, so when you read the text, it is very important to mark some keywords, as I already mentioned. So what are the keywords that you will mark? Any idea? What are the important terms? What are the keywords? What are the special, or what you have to emphasize when you read something, especially these 4 texts? Any idea? Hi Abhi, good afternoon. Grishma, yes, good afternoon. Tara, good afternoon. Yes, Asha, how are you? Okay, so the important keywords that we are gonna mark is all about, the first one is heading. Okay, all the headings we are gonna mark. The second thing is that we have to mark all the subheadings. So when you read text A, maybe you can find a heading, as well as subheading will be there. And when you move to text B, again there will be a heading, maybe there will be subheadings. So it is very important to mark all the headings from all these texts as well as subheadings. And the third important thing is you have to mark all the numbers. Okay, so what are the numbers mentioned here? We have to mark each and every numbers, as well as the signs and symbols. Okay, signs and symbols. So what do you mean signs and symbols? For example, if in a text they have mentioned 17%, okay, 17%, which means 17 is the number and that percentage symbol is there. So we have to mark the both 17 as well as the percentage, which is not a number if it comes with this percentage symbol, that is 17%. Okay, so likewise we are marking every numbers and signs and symbols, which means that symbols which indicate greater than, equal to, less than, okay, all the signs and symbols. Okay, Anita, headings, subheadings, bold letters, very good. Then what else? Okay, so when you study something, when you by heart something, when you remember something, make it or keep it in a proper order. Okay, so as I mentioned, you can write it down: headings, subheadings, all the numbers, signs and symbols. Then we are searching for all the names from these 4 texts. Okay, so if it is a name of a person, name of a disease, name of a place, whatever, you can mark all the proper nouns. Alright, then the next important thing is that all the abbreviations. Abbreviations are very important because they will mention, either they will mention the full form or they will mention the abbreviation. If it is mentioned in the text, you can write that abbreviation into the answers. If it is not mentioned, don't write the abbreviation into your answers. Clear? Okay, so headings, subheadings, numbers, signs and symbols, all the names, abbreviations. Then what is next? What is next? Alright, so it is very important to mark the bold letters or bold words as well as italicized words from the text. Okay, and another important thing is that whatever or whichever words that relate with timing, we can mark. For example, the word indicates now, that can be connected to time, as well as currently, presently, then early, delay, then when, the word itself when, okay, sometimes in. So these type of words that can be related with timing, that you can mark. It is very important. As well as some words which are related to experiments. Okay, for example, diagnosis, the word diagnosis, identification, ascertaining, okay, as well as clinical observations. research related words. So, it is very important to mark all these kind of words. And finally, I would like to say that you have to give always a special focus to all the first and last line of each and every paragraph, because it is very important and it will definitely give you some clues. And the final thing is that all the bullet points we can read carefully. So, these are all about the key words while you do skimming and scanning. Clear? Okay, Anita, we can draw a table ABCD, a definition, condition. Okay, B, signs and symptoms, diagnosis, treatment. Very good. See, this is how you are going to do, because after this process, after your load of efforts and practices, then you will get an idea. Not in the beginning, okay? Not in the very beginning. You will get an idea only when after the completion of a lot of materials. After continuous practice, you will get an idea regarding that. For example, suppose the topic is all about dermatitis, then text A will be all about what is dermatitis. Okay, not always all the time, but 95% I can say text A will always be about the particular condition. What is dermatitis? What are the symptoms of dermatitis? Okay, and when you come to text B, maybe it is all about the prevalence. Okay, and how it affects someone. So, maybe text B, it's all about that. And when you come to text C, maybe they will give a chart. Okay, and definitely one of the text will be a pictorial of something. So, maybe a chart or a table, okay, or a statistical evidence of something. So, something related to a pictorial will be there in one of the texts, maybe comparisons. And in the final one, text D, it's all about the outcome, results. What are the management options, medications. So, likewise, we can create a plan while reading this part A session. Okay? Yes. Very good, Anita. Okay, so let's look into this 4 texts. So, I will read it and you can read with me, mark the important words from the texts. So, the topic is osseous surgery. Osseous surgery, as I am marking the first word which indicates the name of a surgery, is a type of gum disease treatment. Periodontist, again name of a particular expert, okay, periodontist, use this procedure to treat moderate to severe periodontitis. The main goal, the goal which is related to the research goal, okay, the main goal of osseous surgery is to reduce the pockets around your teeth and plaque, and bacteria can't hide there. Then, gum disease destroys the bone and tissues that supports your teeth. Left untreated, it can lead to a host of oral health issues like gum recession and tooth loss. It can also have a negative impact on your overall health, contributing to conditions like heart disease, diabetes and stroke. The main goal of osseous surgery is to eliminate or reduce pockets formed by gum disease. Already we have read that. Then, mild gum disease that has not spread to your jawbone or connective tissue, that is called gingivitis. So, there is another word or a name called gingivitis. It is thought that many as 90%, again there is a number as well as percent of people around the world have gingivitis. So, that is all about my keywords from text A. So, what are your keywords from text A? Tell me. Yes, Kavita, Sheba, Jyoti, Jinsi, hi, Deepika. Okay, and I am moving to the text, second text, that is text B. Here comes a heading. So, that is procedure. So, text B is all about the procedure. During osseous surgery, during is a word which indicates timing. So, during osseous surgery, your periodontist will do something. What are the procedures? Then they have mentioned a lot of procedures here. Give you anesthesia to numb your teeth and gums if you want. So, whatever they have mentioned in the bracket is also important, right? So, if you want sedation, they will also give you those medications before they begin the procedure. Make an incision or a cut along your gum line. Carefully fold back your gums to they can see your teeth roots. Clean the dental plaque and bacteria off your root surfaces. Then smooth and reshape the bone around your teeth to get rid of pockets or areas of damage. Regenerate bone in areas of bone loss if necessary. This could include the placement of membranes and dental bone grafts. Reposition your gums. Then what is the next? Close the incision with stitches. In most cases, periodontal osseous surgery takes around 30 to 60 minutes. So these are the keywords which I have marked from the second text. Then we are moving to the next, text C. Text C. So what about text C? Again we have a heading, follow up. Most people can return to their normal life within a few days of osseous surgery. The periodontist may give you specific recommendations about dietary changes you should make while recovering and a prescription for pain relievers. The following habits may help you recover from gum surgery. What are the recommendations? Avoid smoking, avoid using straw, stick to soft foods, physical activity. Avoid physical activity after surgery. Change your gauze regularly. Rinse your mouth with salt water after 24 hours. Okay, and place an ice pack against the outside of your mouth to manage swelling. So these are my keywords from the third text. Then moving to the final one. Yes, here it is a pictorial. Okay, contraindications they have mentioned. So these are the contraindications. Patients who do not exhibit good plaque control, uncontrolled or progressive systemic disease which includes diabetes, leukemia and all. Patients taking large doses of corticosteroids may have reduced resistance to stress associated with surgery. Patients with imminent terminal disease who are debilitated are not candidates for surgery. So all about the contraindications. So this is how you are marking all the keywords when you read each and every text. Okay, hope it is clear. So this is how you are gonna read each and every text. Okay, so now we are moving to the first set of questions, that is 1 to 7. Okay, which are called match the following questions. And what is the instruction mentioned here? For each question 1 to 7, decide which texts. So we are matching with each and every text to find out the correct answer. A, B, C or D. The information comes from, you may use any letter more than once. No problem. Okay. So what is the first question? When you read the question, it is important to mark keywords as well as from the question also. Okay. And you can mark a maximum of 3 keywords from each and every question. Okay. So why we are marking keywords from the question? It is just to understand the question within this stipulated time. Okay. So what are the keywords? During, that indicates the timing. During the surgery, the periodontist will assist us to do away with pockets or areas of damage. So where is it mentioned? This periodontist will help you, assist you, okay, or assist us to do away or to get rid of with pockets or areas of damage. As you can see from text B, the procedure itself is mentioned in text B, and here they have mentioned the expert, the dental expert, a periodontist. So that is what they have mentioned here. See this point, the 6th one. Okay, smooth and reshape the bone around your teeth to get rid of pockets of or areas of damage. So those are the keywords from the question. So the correct answer is text B. That is the answer, text B. Very good. Jyoti, very good. Abhi, very good. Jinsi, good. Ranju and Anu. It is from text B. Very good. Nice participation. Okay. What about the second question? Eatables. Okay. Eatables, that is related to food. To be included in the routine of the patients following osseous surgery. So what are the foods that we have to include after the surgery? Any idea? Second question. Very good. That is from text C. Again, it's all about the follow-up. So, what you have to do after the surgery, post-surgery measures. It is in text C. So, here they have clearly mentioned what? Stick to. You can include soft foods for the first few days. So, which is mentioned in text D. So, text D should be the answer. Sorry, text C should be the answer. Okay. Then, third one, the foremost objective of OCS surgery. The foremost, which I can say the most important. Okay, or I can say the most, the important objective, the aim, the goal of OCS surgery. And already we have read that, okay, from text A. The main goal of OCS surgery, which is mentioned in 2 paragraphs. Okay, so of course that answer is text A. That is from text A. Then the fourth question, those who are not qualified for OCS surgery. So, which is definitely who are not qualified, which means they are talking about the contraindications, right? So, that is from text D. As you can see here in the box, in the last point also, patients with imminent terminal disease who are debilitated are not candidates for surgery. Okay, so we can select that answer. It is from text D. Okay, and what about the fifth one? Essential guidelines, important recommendations. They are talking about the guidelines. Of course, you know what are guidelines, recommendations? A set of instructions, right? So, where is this guidelines mentioned or recommendations mentioned? Essential guidelines to be followed by the recipients of OCS surgery. Any idea of fifth question? And that is from text C. So, here they have mentioned specific recommendations, a lot of guidelines, follow-ups they have mentioned here. So, that answer should be text C. Text C is the answer. Sixth one, detrimental effects of gum disease. What are the side effects or what are the negative impacts of gum disease? Sixth question. What is the answer, Tara, for the sixth question? Yes, it is option C for fifth one. Very good. What about sixth one? Detrimental effects or negative impacts? Very good. That is text A. Okay, so that is mentioned in text A, as you can see here in the second paragraph. Gum disease destroys the bone and tissues that support your teeth. Left untreated, it can lead to a host of oral health issues like these and these, and it can also have a negative impact, which we can say what? Detrimental effects. So, that answer is text A. And moving to the last question from the set of match the following questions. The minimum duration required to complete OCS surgery. So, what is the duration? And the duration which is mentioned in the procedure, right? So, that is from text B, the last line. In majority of the cases, periodontal OCS surgery takes around 30 to 60 minutes, and that is from text B. So, these are the answers. Great. 7 out of 7. Very good. B and Kavita, excellent. Okay. Then we are moving to the second set of questions, that is 8 to 14. Again, I am reading the instruction. As you know, answer each of the following questions 8 to 14 with a word or a short phrase. So, again, what do you mean short phrase? Maximum, I can say maximum of 3 words. Okay, according to the question, it should be the maximum of 3 words, right? Okay. So, short phrase from one of the texts. Each answer may include words, numbers or both. So, you can add numbers or words or both. Okay, no problem. So, the 8th question, names. We need names of the uncontrolled progressive or systematic diseases from forewarning. So what is the answer? Names of the uncontrolled or progressive systematic diseases. Okay, so which is in the contraindication. So forewarning is mentioned in association with contraindications. So what is the answer? Answer should be from second point, uncontrolled or progressive systemic disease. That is, those are the keywords from the question. So the answer is diabetics as well as leukemia. Okay, so answer is diabetics and leukemia. So these are the answers. Okay, then ninth one. This area may get exposed with the folding back of gums during surgery. This area, which area? What area? Get exposed with the folding back of gums during the surgery. So during the surgery, which means at the time of the procedure, right? So definitely that procedure which is mentioned in text B. So what is the answer? What is happening there? So as you can see here, this point, carefully fold back your gums. So those are the keywords from the question. So answer is, they can see, which can be related with exposure. Okay, teeth roots should be the answer. Very good, Kavita. That is teeth root, not rib pocket. Answer is teeth roots from text B. Okay, Jyoti, very good. Teeth roots, yes. Tara, it should be teeth roots, okay, not roots, teeth roots. Okay. Then the next one, 10th one. What solution, okay, what fluid or what solution is used by the patients to clean out their mouth after 24 hours of surgery? Again, we will get the answer from the follow-up. Okay, after the procedure, there is some follow-up recommendations. So the second last point is mentioning about this one. Rinse your mouth with salt water after 24 hours. So what is the answer? Very good, Renju. Salt water is the answer. Yes, Shiba, salt water. Asha, salt water. Very good, very good. Yes, Kavita, salt water. Yes. So answer is salt water. Everyone got the correct answer. Very good. Salt water. Okay. Then 11th one. Which medication intake, okay, which medication could affect the decreased resistance to stress associated with surgery? Which is the medication? Okay, so already we have seen some medications in contraindications, right? So what is a medication related to stress? Any idea? Okay, what is your answer, Jancy? Which medication? That is corticosteroids. Answer is corticosteroids from text D. Answer should be corticosteroids from text D. Then the 12th one, oral health issues associated with gum diseases if it is left untreated. So if you are not giving the treatment or left untreated, where is it mentioned? Okay, so the treatment and left untreated, that is mentioned in text A. That is from text A, the second paragraph. Okay, so the answer should be what? What is the answer? It is, when you left untreated, it can lead to a host of oral health issues. So what are the issues mentioned? Gum recession and tooth loss. So answer should be very good, very good. Okay, that is from text A. Okay, then the 13th one, this comorbidity can be treatable, this disease condition can be treatable with placing ice packs after the surgery. So after the surgery, which means the follow-up, right? Okay, so definitely that is from follow-up. So the last line, place an ice pack against the outside of your mouth to manage swelling. To manage what? To manage swelling. So answer is swelling. Very good, very good. Yes, Yogeshwari, Suresh, swelling. Jilmi, Joy, swelling. Hi Jilmi, how are you? Okay, Jyoti, swelling. Renju, swelling. Yes. Jasmine, swelling. Yes. Jansi, swelling. Very good, very good. Excellent. Okay. Yes, Sarala, swelling. Anu, Jinsi, yes. Shiva, swelling, yes. Answer is swelling. Then what about the next one? 14th one. Mild gum disease that has not spread to the jawbone or connective tissue is called dash. Okay, so that is the name of a particular thing, right? Called something, name of something. So it's from text A. Already we have noted the name of this. What is it? Mild gum disease that has not spread to your jawbone or connective tissue. That is called gingivitis. So answer is gingivitis from text A. Okay, so that answer is gingivitis. Okay. Anyone got the correct answer? Gingivitis? Okay. So next one. Okay, so we have completed the second set of questions, which is short answer questions. Now we are moving to the final set of questions, that can be called fill in the blanks question. Okay. Then what is the instruction? The same instruction as in short answer questions. Okay. Complete each of the sentences 15 to 20 with a word or short phrase again. And each answer may include words, numbers or both. Okay, Abhi, again you got 7 out of 7. Excellent. Okay. So you are an expert in reading, right? Okay. So the 15th one, if required, regeneration of bone in areas of bone loss, including the placement of membranes and dash, are being done. So when you deal with fill in the blanks questions, what is important? What is important? Okay, they will not give you the direct words from the paragraph into the questions. Instead of that, they will give you synonyms. So what are synonyms? Which means the same meaning but different words. Okay, so they will not give you the exact line or exact word from the question. Instead of that, they will give you synonyms. So with the help of these synonyms, we are finding the correct answer. Okay, so when you fill the correct answer, it should be the missing word from the paragraph or the sentence. Okay. So if required, regeneration of bone in areas of bone loss, including the placement of membranes and dash. So what is the answer for question number 15? It should be dental bone grafts from text B. Okay, so where is it mentioned? Dental bone grafts. Okay, so this is the point. Okay, regenerate. So that is the keyword from the question. Again, bone in areas of bone loss. Another keyword. This could include the placement of membranes. Another keyword. And answer is dental bone grafts. This should be the answer. Dental bone grafts. Okay. And the next question, 16. Aborting the habit of dash might be difficult, but your doctor can help you build a plan that works for you. So what is difficult? Habit of dash might be difficult. So what is difficult? After the surgery, it will be difficult. What will be difficult? And that is from follow-up. Okay, so what will be difficult? And that is mentioned here, smoking. Avoid smoking. Why avoid smoking? Which can be difficult, might be difficult, may be difficult. Okay, so that answer is smoking. Very good. Yes, smoking is the answer. 17th one. Patients with dash who are debilitated are not candidates for the surgery. Already we have heard this question, right, before. So, patients with dash. So, what is the missing word here? That is from contraindications. Okay, it is the direct answer, and that is from the last point. Patients with imminent terminal disease. That answer should be terminal disease who are debilitated. Another keyword. Are not candidates. Another keyword. Okay, so that answer is terminal disease. Okay. Then the next question. The main goal of OCA surgery is to reduce the dash around your teeth so plaque and bacteria can't hide there. Where? And reduce the dash. Okay, so what is the answer? The main goal. Where is the main goal mentioned? The main goal which is mentioned in text A. Okay, so that answer is, what is the answer? It is the main goal of the OCA surgery is to reduce, that is from the first paragraph, the second line. The main goal of OCA surgery is to reduce the pockets. Answer is pockets. Okay. Then 19th one. In most cases, periodontal OCA surgery takes about dash. So what is this dash? Takes about dash. And that is from text B, from the procedure. See the last one. In most cases, in majority of the situations, periodontal, that is another keyword, OCA surgery another keyword, takes around 30 to 60 minutes. Answer should be 30 to 60 minutes. Very good, Prida. How are you? Okay, 30 to 60. Yes, Kavida, 30 to 60 minutes. Okay, very good, very good. Yes, Renju, 30 to 60 minutes. Yes. Very good. All right. Yes, Jinsi, 30 to 60. See, when you write 30 to 60, it is like, it is a hyphenated word, right? Yeah. No, it is 30 to 60. Okay, that answer should be 30 to 60. Okay, okay. Yes. And the last one, untreated, left untreated, not giving the treatment. Gum diseases can also have a negative impact on your overall health, contributing to conditions like dash, diabetes and stroke. So what is the answer? Conditions like dash, diabetes and stroke. So the answer should be from text A. Okay, so what I have mentioned here. Okay, so that answer is very direct. It can also have a negative impact on, that is another keyword from the question, negative impact on your overall health, contributing to conditions like heart disease, diabetes and stroke. So that answer should be heart disease. Okay, so that is the answer. All right. Okay, so please be careful about your spelling. Okay, heart disease. What is the spelling of disease? Okay. So any doubts regarding any of the questions? Excellent, excellent. Okay, Kavita, 20 out of 20. Jansi, 20 out of 20. Excellent. Abhi, 20 out of 20. Okay, very good. All right. So as I'm always saying, if you have any doubts or any confusions, any queries regarding the sessions, regarding our classes, regarding anything, you can contact us in the number mentioned here on the screen. Okay. So as I said in the previously or in the beginning, please do a lot of materials, practice regularly and achieve your dreams. Okay. So that's that. God bless you all.